several African countries are battling a third wave of infections. For more on this, we are joined by Dr. Ahmed Ogwell Ouma, the Deputy Director of the Africa Centers for Disease Control and Prevention. Doctor, welcome to Africa Live. Welcome to the program. Let me begin by asking you, how is the Delta variant of COVID-19 impacting the African continent, Doctor?
Thank you for having me. We on the African continent have documented all the 4 major variants that have been seen around the world, including the Delta variant. And at the moment, although we have documented the Delta variant, it is not being transmitted at high enough rates for us to say that it has overtaken the original virus or the earlier variant that have been first characterized in South Africa. But for sure, the Delta variant is on the continent, and we are concerned that as it spreads, it will cause complications to our strategy to interrupt transmission in Africa.
All right, Doctor, given that even those fully vaccinated are still at risk, what is the best way of managing the spread of the Delta variant?
I think it is important to understand 3 things around vaccination and infection by the virus causing COVID-19. One is that vaccinations do not stop an individual from getting infected. You still get infected if you're exposed. What the vaccines do is they significantly reduce the risk of getting seriously ill. A person who has been vaccinated, if they do get infected, then the viral load usually is relatively low. But with the Delta variant, the viral load is being seen to be much higher than the other variants or even the original virus itself. So it means that someone who's been infected by the Delta variant, even if one has been vaccinated, has increased potential of transmitting it to others. And that is why we are saying that even those who've been vaccinated, we must continue to observe the public health measures of masking up, avoiding crowds, so that we can reduce and interrupt the transmission of the Delta variant through those who are not vaccinated and even those who are vaccinated. But let us not characterize it as breakthrough, because the risk is much, much lower than the threshold of a breakthrough.
All right, very important and significant point that you've made there, Doctor. That brings me to my next question. Doctor, some countries are experiencing surges at different times, like what's happening in Kenya, Uganda, and Rwanda. Why is this so?
Surges are essentially seen in 3 situations. One is that a country is testing at the recommended rates. Second is that the transmission is being seen within particular defined areas. It is not dispersed throughout the country. And third, what kind of virus, the type of variant that is resulting in these infections. In the situation of the countries that you mentioned, neighboring countries seeing different levels of transmission, it is essentially because countries are working to beat down the curve, and they are doing that at different times. And we do not have enough cross-border communication and individuals crossing borders. We don't have that at high enough levels for one country's surge to affect the next country's surge. But we are seeing the surges at different times because countries on the continent are doing a good job of bringing down the numbers, and then the next country is not starting at the same time. So they are not synergized for the reasons that I mentioned just now.
All right, Dr. Ahmed Ogwell Ouma, let's leave the conversation here for now. We appreciate your expertise. Many thanks.